Hemostasis. Textbook. Guyton and Hall. Textbook of Medical Physiology. 11th edition. Pages 457 to 468. Chapter 36. Hemostasis and blood coagulation. Part 6. Blood coagulation tests. Bleeding time. When a sharp-pointed knife is used to pierce the tip of the enger or lobe of the ear, bleeding ordinarily lasts for 1 to 6 minutes. The time depends largely on the depth of the wound and the degree of hyperemia in the enger or ear lobe at the time of the test. Lack of any one of several of the clotting factors can prolong the bleeding time, but it is especially prolonged by lack of platelets. Bleeding time lab test. Bleeding time lab test is performed via 2 primary methods based on the length and location of the incision. IV method. The IV method is the most commonly used method. A blood pressure cuff is applied to the arm and inflated to 40 mm mercury. The patient's forearm is then cleaned with alcohol, and an incision is made with a sterile blade or scalpel, 1 mm deep and 10 mm long. Since the test is directed to capillary vessels, the area should have no large vessels. Clotting time. Many methods have been devised for determining blood clotting times. The one most widely used is to collect blood in a chemically clean glass test tube and then to tip the tube back and forth about every 30 seconds until the blood has clotted. By this method, the normal clotting time is 6 to 10 minutes. Procedures using multiple test tubes have also been devised for determining clotting time more accurately. Unfortunately, the clotting time varies widely, depending on the method used for measuring it, so it is no longer used in many clinics. Instead, measurements of the clotting factors themselves are made, using sophisticated chemical procedures. Prothrombin time. Prothrombin time gives an indication of the concentration of prothrombin in the blood. Figure shows the relation of prothrombin concentration to prothrombin time. The method for determining prothrombin time is the following. Blood removed from the patient is immediately oxalated so that none of the prothrombin can change into thrombin. Then, a large excess of calcium ion and tissue factor is quickly mixed with the oxalated blood. The excess calcium nullies the effect of the oxalate, and the tissue factor activates the prothrombin to thrombin reaction by means of the extrinsic clotting pathway. The time required for coagulation to take place is known as the prothrombin time. The shortness of the time is determined mainly by prothrombin concentration. The normal prothrombin time is about 12 seconds. In each laboratory, a curve relating prothrombin concentration to prothrombin time, such as that shown in figure, is drawn for the method used so that the prothrombin in the blood can be quantified. Do you have any question?